The outcomes of Forum 2012 are absolutely critical, and in my view, there are three important outcomes that would be good if they come about. The first one is clearly the issue of connecting players from different sectors of society so that they can work out on mechanisms to improve research, development, and innovation. I think it is well known that people in academia, people in industry, and the policy makers in the ministry work in silos, and the power lies in connecting those people. And these connections are not only in terms of the industry or the site of work, but there are also connections between people working in the north and people working in the south, people working in the south and the south, and the north and the north. So the connection issue towards improving health research is key. So that's number one. The second issue is actually one of ideas. We need new ideas on how to overcome some of the intractable problems that exist in this field. One of the key problems is obviously how to translate research findings into useful knowledge for society that changes the outcome of society, of people in terms of health, and that improves their well-being. There clearly is a chasm which we need to deal with and we need to address. The final point, which some of us in the National Health Research Committee of South Africa have taken advantage of, we've taken advantage of this meeting to organize a meeting of African health researchers under the auspices of the World Health Organization Africa region. We will be meeting here in Cape Town on Friday and Saturday to have our discussion about what do we do as Africans. And one of the potential outcomes of that meeting is the formation of an African Forum for Health Research, which will seek to do to Africa what the Global Forum is doing to the world, which is, again, to connect these Africans, because these Africans are not talking to each other in these different sectors. The person in the ministry is not talking to the person in the university, the person in the university is not talking to the person in industry, and as a result, research does not progress. And of course, ideas in research are critical, and ideas come about when people put their heads together about overcoming some of the problems. So those are the three main outcomes: connecting people, new ideas, and the formation of the African Forum for Health Research. In South Africa, we are beyond aid, right? We are beyond aid. Our problem in South Africa is one of coordination, right? We are fragmented, and this is the historic legacy of apartheid, where things were split up, where people have got little fiefdoms and they fight among each other. So the critical issue for us to progress is to find connection internally. So the idea of connecting is hugely relevant for South Africa. We clearly need ideas. We do not know how to solve some of the major health problems that we face. As you know, the paradox of freedom has been that the health condition of South Africa has deteriorated. In 1990, the life expectancy of a South African was 70 years. In 2010, it was 50 years, right? A reduction of 20 years in one generation. That's almost unprecedented. And that represents a reversal, a great reversal of fortunes. We need research to address that, to deal with the problem of HIV and AIDS and TB, which was responsible for that, to deal with the new problem of chronic diseases such as heart attack and stroke, which are rising, to deal with the problem of mothers dying around the time of childbirth, babies dying around the childbirth or before they have reached the age of 5. And the fourth great problem, great sport of South Africans, the problem of violence and injury. Right now, those four great problems have conspired to reduce the age of the life expectancy of South Africans. We call them the quadruple epidemic. Now, we really need all ideas of how to reverse that, and it's going to be a project that will require all talents, within South Africa to solve. The legislators foresaw the need for a committee that will advise the Ministry of Health as well as government on 4 issues. 1, priorities for health research in South Africa. 2, resourcing health research, funding health research, right, in South Africa. Number 3, developing a policy for health research. And finally, coordinating research that is done by public entities. And the present Health Research Committee believes actually that mandate extends also to private entities. We've taken a poetic license to interpret that act to say that we are actually in charge of health research in South Africa with respect to those 4 issues. So it is a pivotal body that sits at the center of trying to ensure that there is a strategic steer at the center of the health research effort of South Africa. The minister appointed us a year ago, the present committee, and this present committee has set about diligently trying to achieve those requirements. We had a National Health Research Summit in July that has produced the priorities for health research in South Africa, and the Minister of Health on Thursday at the Cullinan at 6:30 will be launching the findings and the recommendations, and will be indicating how government is beginning to respond to those priorities. And we think government ought to be much more ambitious than has been the case so far. We must make sure that in the health budget of the country there's appropriate investment in health, and we think that 2% of the budget of the Department of Health should be on health research. The budget of the Department of Health last year was 112 billion, right? So we mean that at least 2 billion must be going to health research. When we worked out the sums, it was a mere 447 million that the Department of Health was spending on health research. So they need to more than quadruple that budget. And we've said, the minister, using the language of the Constitution, that he needs to ensure that there is a progressive realization of that aspiration within a reasonable time, within 3 years. And if we did that, we will, I think, put ourselves on the high road towards success in research.